Good morning, my name is Deborah from Group 8 of the 8 article about coronavirus. So, what is coronavirus? Coronavirus is a collection of viruses that can infect the respiratory system. Image is the first only infection in COVID-19 and was first discovered in the city of Wuhan, China, in December 2019, this virus caused and spread other regions in China. Symptoms of coronavirus infection of COVID-19 can lose sufferers to experience flu symptoms such as fever, running nose, concerted, and headache. However, in general, there are three kinds of infection with the coronavirus. Step 1. Fever, a body temperature about 38 degrees Celsius. Step 2. Count short time of birth according to research COVID-19. Step 3. Symptoms vary with 2 days to weeks ever exposed safe coronavirus. You don't know how to prevent coronavirus yet? Don't worry, I will mention 10 ways to prevent coronavirus. Step 1. Wash your hands frequently. Step 2. Avoid close contact. Step 3. Mention social distancing. Step 4. Use a mask if sick. Step 5. Stay at home. Step 6. Avoid touching eyes, nose, and mouth. Step 7. Avoid the around. Step 8. Not shaking hands. Step 9. Always update information regarding COVID-19. Step 10. Immediately to the hospital if you experience symptoms of COVID-19. Okay, thanks what I say I love you can set the time to leave the house and confinement regulation. Okay, thank you very much and good morning. See you. Bye bye.
Here we go. Okay, so coronavirus. So I'm sure everybody's heard of the coronavirus, unless you've been on vacation somewhere for the last couple of months. But coronavirus is a virus that's kind of spread and certainly has originated from China and from Wuhan province. And recently just named COVID-19, and I'm not sure if that's going to stick or not, but that's the new name that's been given as the COVID-19. The coronavirus, although affects a lot of folks, but is about 3%, has a 3% mortality, is no different as far as symptomatology than our common flu. So, you get fever, you get cough, you get sore throat, nausea, shortness of breath, but those symptoms are no different than your common cold or common flu. How does it spread? Again, no different than what we see with those folks who contract the flu, meaning person-to-person contact, coughing, sneezing on those that are close to you. How do we prevent this? Wash our hands with soap and water. Avoid touching your eyes, your mouth, or nose with unwashed hands. Avoiding close contact with those who are sick. And if you feel like you're sick, just common practices. Stay home, stay from school, stay home from work, and seek medical attention. And certainly, in specifics to coronavirus, if you have risk factors, and what are considered risk factors, of course, if you've been to China, if you have family, friends, coworkers who have been in the last couple of weeks, and you develop symptoms, it's not 100% that you have it, but be smart and seek medical attention. And the other thing is not only seek medical attention, offer that history. Certainly, every person that comes and walks our emergency department and our clinics, we screen them for, do you have URI symptoms? Do we screen them for their travel history? And we have questions in place, and not only trained our staff, but we have it built into our electronic medical system that has reminders to remind everybody to ask those questions. This is just a snapshot of our emergency department, and as you can see, right in the front, we have big signs that both in English and also in Chinese and / Cantonese, asking patients if you have these symptoms, if you have risk factors, to please speak up and tell somebody right away. And should they have those, we mask those patients right away. Our infectious disease department, Dr. Martin and her staff have done an excellent job training our staff to be vigilant and should the patients have those risk factors, what to do. And we have a whole team, if you will, that gets mobilized, and we have negative pressure rooms where we isolate the patients. We work very closely with the Alameda Public Health Department to follow their guidelines, who in turn get their guidelines from the CDC. And in fact, I think I was talking to somebody, and we were actually commended for being so strict and on point with our protocols from the Public Health Department, which is great. This is one of the signs that's kind of blown up, but we have posted not only in our triage rooms, but outside when they come in for intake. The resource that we use are, again, from the CDC, from the Public Health Department, from Alameda. The key with coronavirus, I can tell you, is no different than your common flu. However, if you have risk factors, be vigilant. I would even recommend, if you're going to go see a doctor, call ahead of time. Say, I'm coming in, or if you're going to come to the emergency department, call ahead of time, and we're happy to meet you and get things started so we can better take care of you. I do want to commend our infectious disease folks, our nurses, for having such great ability to take care of these patients, because truly, there's been hysteria almost with the coronavirus, but I think what we're doing is not any different than we did for MERS, what we did for the bird flu, what we did for SARS, and what we do daily with patients who come in. Before the coronavirus, we were masking patients and asking questions and isolating them. So I think this just kind of adds another level to that. And I think we're doing a great job, and I think we'll continue to do so and see where it takes us. Do you have anything to add, Dr. Martin?
The only thing I was going to say.
Oh, sorry.
The only thing I was going to add is, we have been sort of anticipating a problem and basically coordinating multidisciplinary groups between nursing and pharmacy and environmental services and everything to try to get together. And we didn't realize we were going to need to put that into practice. But about 2 weeks ago, we did. We had patients who were strongly suspect, and it was amazing to me to see how well coordinated this team did. I was able to sort of sit in the back corner of the conference room and just able to see all the things that were going on. The ER handled it competently. We worked with CDC, we worked with the Alameda Public Health, and the family was happy that everything was taken care of. So I think you don't realize behind the scenes what a tremendous team is going on here, taking care of something that turned out to be inconsequential, but was handled in terms of making sure that everything was done properly. They actually had a patient sent here because we had negative pressure rooms. So we're like a magnet, I think. But, it was from top to bottom, from the administration all the way down to environmental services. Everybody worked as a team, and it was so coordinated. It was amazing to see.
It really was.
Yeah.
Oh, that's good. I understand that our hospital and possibly others are having less incidents of admissions for flu during this particular flu season. And hopefully it's got a lot to do with all of the efforts to the public to get flu shots and wash their hands. Although I guess a flu shot does not work against coronavirus, right?
Right. It's not a there's not a vaccine for the coronavirus, or is there a known antiviral medicine for it? But our immune system is pretty strong. Again, we don't know everything about coronavirus as far as who it affects most or not. But if I had to guess, I would say it's, folks who have risk factors, immune compromised, diabetes, and such.
Yeah.
But the flu itself, the flu A and B, hasn't been as virulent as it was last year that we saw.
Mm-hmm.
Last year a patient would come in emergency department with flu. I know that patient is going to be admitted. Now, I admit maybe 10 to 15% of those patients. So yes, we're seeing flu, but it's not as virulent as it was last year.
Mm-hmm.
And certainly we haven't seen any confirmed cases at Washington Hospital of coronavirus this year.
Yeah. Well, thank you, Dr. Halimi.
Thank you.
Dr. Martin, thank you. Any questions? Thank you very much.